Atrial fibrillation is the most common type of heart arrhythmia present today, affecting up to 700,000 Canadians, with the incidence of the condition doubling after age 55. The Canadian Cardiovascular Society has therefore drawn up recommended guidelines for management and treatment of patients with atrial fibrillation. Dr. Paul Dorian, cardiac electrophysiologist at St. Michael's Hospital, is chair of the arrhythmia section of the Connectin Canadian Cardiovascular Clinical Trials Collaborative. His training at Stanford University and interest in atrial fibrillation, the clinical pharmacology of antiarrhythmic drugs, and quality of life in patients with arrhythmias make him an expert on the subject. Here's what he had to say about the new guidelines.
It's important to know that there is much that's new in the investigation and treatment of atrial fibrillation, and the guidelines therefore offer a comprehensive and detailed help to practitioners to better assess patients and better to treat them. In general terms, the guidelines currently emphasize that all patients with atrial fibrillation should be carefully assessed with respect to the etiology of their atrial fibrillation, paying particular attention to hypertension and sleep apnea as causes or cofactors. Importantly, emphasizes the quality of life that is frequently impaired in patients with atrial fibrillation and the assessment of quality of life as the primary factor which we use to stress what management strategies should be employed.
In atrial fibrillation, the electrical signal from the brain to the heart telling it to beat becomes confused, and the atria quiver rapidly and unevenly, changing the constant rhythm of the heart. This leads to a condition known as tachycardia, the irregular and often too fast pumping of the ventricles of the heart, or worse, stroke. But the disease is manageable with the right medication or treatment, both of which are set out in the guidelines.
The management strategies for atrial fibrillation are discussed at length in the guidelines. They consist primarily of the rate control and the rhythm control strategies. Rate control refers to the control of the heart rate frequency or rate, and there are medications to slow the heart rate in patients with symptoms. The rhythm control strategy involves the restoration and maintenance of sinus rhythm, usually with antiarrhythmic drugs, and the type of antiarrhythmic drugs and their side effects and the recommendations for specific drugs are detailed at length in the guidelines. There's a separate chapter on radiofrequency ablation for the restoration and maintenance of sinus rhythm that's also contained in the guidelines, with a discussion of the place of ablation in the hierarchy of treatments for rhythm control.
It is estimated that this disease causes up to 15% of all strokes, as the risk of stroke is 3 to 5 times greater in people who have atrial fibrillation than those who do not. More information and links to the guidelines are available online.
Useful resources to obtain information about atrial fibrillation and its treatment include the Canadian Cardiovascular Society website, which contain links to the guidelines themselves, the Heart and Stroke Foundation of Canada website, the American Heart Association website, and the European Society of Cardiology website. These latter associations also have guidelines.